And joining us this week is Michelle Bodner, who is the President and Chief Executive Officer of Curaleaf New York, the company that owns and operates the medical cannabis dispensary in Plattsburgh. Welcome, it's nice to see you.
Yeah, thank you for having me.
Your company took over the dispensary from the original operator, Columbia Care, earlier this year?
Yes, it was in May.
And in recent months, people have really seen a lot of changes, and that's by design, probably.
Absolutely by design. So we've made a lot of changes since being here. In a few short months, we have increased the patient count fourfold. Very, very proud of that. And really, I think the reason for that is because of the way we execute our vision. So first of all, medical marijuana is not covered by medical insurance. So the affordability of medicine is very, very important. There are many patients in the North Country who very much want to try medical marijuana as an alternative treatment, but they can't because they can't afford it. So what Curaleaf does is to provide really the very best medicine at an affordable price. So we think it's very, very important for patients to be able to get our medicine. And we'll be able to, we're just now rolling out some of our brands, which will be coming out over the next couple of weeks, and we'll be able to deliver on that initiative even further. I think also what we're doing differently is we are very active in outreach and education. So we interact with the healthcare community, with the patient community, and provide education on this new medical tool. And I think that's certainly borne some fruit.
How many patients do you have now?
Right now it's about 1,600 patients. Yeah, so we're again very, very proud of that growth, and it's growing quickly.
Many counties here in the North Country depend on this dispensary.
That's absolutely true. I mean, people travel as much as 3 hours to reach our dispensary. And I think that's something that the administration is working on. But what we can do, and we will be doing soon, is rolling out a home delivery service. So patients with limited mobility will have access to our medicines, where now it's quite difficult. So we're very proud of that.
And you talk about the cost. Is it cost prohibitive right now?
I think it is. I think it is. Again, we're doing what we can. We have special initiatives such as discounts for veterans. The regulators are very focused on this. They understand the issue. For example, Assemblyman Dick Gottfried just introduced a bill to make medical marijuana covered under public health programs, such as Medicaid and others. That's a big deal.
What's the average cost a month for a patient?
It varies. It really does. It varies by patient. It's a little bit difficult to give an average, but certainly it's more expensive than medicines that are covered by health insurance.
And that would be a start to at least help some people who are receiving public health insurance.
It would be a terrific start. I mean, some of the most needy patients in New York State would then have availability of the medicine, where right now it's very, very difficult for them.
And the hope is long-term more insurance companies may cover at least part of the cost?
That's the hope.
And the number of conditions. When this first started, the program was fairly limited in the number of conditions that were covered. That has expanded over the past few years and continues to expand now. PTSD, cancer, chronic pain, and is it even also for opioid addicts?
Not just addicts. Anyone who is prescribed an opioid, a registered practitioner can actually write a recommendation for medical marijuana. It's, Tom, 50,000 people in the United States have died this year from opioid addiction. It's obviously, I know you've covered before. It's a very serious problem. Medical marijuana is a low addiction drug, and there's not a single incidence of fatality, so it's more easily titrated. So it's a very, very attractive alternative for practitioners to recommend to their patients. Opioids have their place in the medical world, of course, but I think if someone is suffering from a chronic condition in particular, medical marijuana is certainly an important alternative to be able to offer patients.
How can folks find out if they're eligible and if they have a condition that would be covered, that they could use medical marijuana?
Well, they can call us. We have an 800 number. We're here to answer any question that they have. We're very committed to being available to answer questions. There's a lot of misinformation out there, and we're here to give them correct guidance and information.
One of the criticisms of the program when it first started was it was so secretive that,
Yeah.
that you could go on the website, but you couldn't see a list of doctors, practitioners who
Yeah.
could prescribe medical marijuana. Has that changed over the past few years? Is it much easier now to find a doctor who can prescribe medical marijuana?
It certainly is. I mean, again, I think the administration has done a very good job expanding the program, making the program more accessible. But I think there's some room to improve, and I think the administration understands that.
You're looking at more expansion, covering more conditions. What do you see for the next 2 or 3 years? What are companies like yours asking the administration to do?
Yeah, so we do. I mean, we want to see more qualifying medical conditions, certainly, and I think access is very important. As I said, we have some patients that travel 3 hours to our dispensary. I think we need more dispensaries.
What are some of the conditions that aren't covered now that you would like to see covered?
I think some of the acute pain conditions would be helpful. There is research around autism, and we'd like to take a closer look at that as well.
Are more doctors now in the North Country that patients can go to get prescriptions?
Yeah, there are. So there are nearly 20 doctors right now in the North Country who can write the recommendations. I think I'm gonna give Curaleaf some credit for that.
And is it only the patient that can request it, or can caregivers also request it?
Caregivers can request it on behalf of their patients.
So the doctors have to see those patients before they can get approved to use the medical marijuana?
They do. In New York State, however, they provide an option, which is actually very, very helpful and quite good. There are some telemedical doctors, so you can actually get a recommendation through telemedicine.
Who's the typical patient that you help, and how does it help them?
Well, surprisingly, our average patient is 56 years old and obviously suffering from one of the qualifying medical conditions, and is typically new, comes in knowing very little about medical marijuana.
And when the program started, one of the criticisms again was that the only means that you could take the marijuana would be by drops from like an eyedropper, or perhaps a drop you put in your mouth. Has that changed, and have they gotten to the point where they're, if they haven't approved, they're thinking about approving edible marijuana?
They're certainly expanding, they being the Department of Health, the New York State Department of Health, is certainly entertaining new ideas. We will be coming out with a mint micro tablet, also a gummy type, and we're also actually going to be coming out with a ground flower product where people can vaporize actually ground flower.
So there are going to be other options then?
There will be options. Yeah, right now we sell tinctures, capsules, and vape pens, and that's generally what's available in the market.
You are the largest medical cannabis company operating across the country. How many states are you operating in?
We're currently operating in 10 states, soon to be 12.
And as New York now enters the new year, and it appears that New York's going to likely consider legalizing recreational marijuana, how does that impact the medical marijuana industry?
They are very, very focused on maintaining the integrity of the medical program. Other states have not been so focused, and they're looking very carefully at what's transpired in other states to make sure that the medical program is not only protected but also expanded.
In other states, was that a problem where if they legalized recreational marijuana, it affected the medical program?
It was. It's easier to access when in a state where adult use is legal. It's simply easier to obtain, so you don't have to go through your practitioner. And many people choose to take that route, but the administration is looking at that very, very carefully.
You think in New York they would still keep it separated, and medical would be one thing, recreational would be the other?
They absolutely are committed to maintaining the medical program.
And for your company, if there is recreational use, does your company expand into that, or are you strictly focused on medical cannabis?
Again, we're a medical company. I think, when the regulations come out, we'll take a look at it and we'll make a decision then.